Hi, I am Dr. Laurie Pozun, and I'm so excited to be here with you today at Lifescape Premiere. So our office, our group has been doing a weekly informational session on Facebook Live for the last couple of weeks. This will be my first session, just to kind of update our patients and the public about any recent information that's coming up and kind of new through the pipeline. So I really appreciate you all being here this morning. Hopefully you can see me and hear me. If there's any issues with any audio through this, feel free to reach out and let me know. And at the end of this, hopefully we'll have time for some questions and answers. I will preface this by, throwing a question out there and asking all of you, how stressed have you been through all of this? Most of us are experiencing some stress during this time. This is kind of something that is completely out of our comfort zone, and we truly, I think, are all in this together. I love the phrase "alone together." I tend to be an eternal optimist, and I'm trying to look at the good in all of this, and I think it is giving a lot of us a chance to be able to kind of refocus on what really matters. Maybe it's the universe's way of putting that out there for us to make us refocus on what's important, our health. That's huge, obviously, and our family and friends. So just try to stay positive through this. It will end, and hopefully we'll be better off when all of this is over, and be more informed and be more careful. Some of you may be at home working right now. You may be stressed because you've been laid off. You may be trying to multitask at home right now, as many of us are, with trying to work and, kids running all over the house, and trying to be a homeschool teacher for your children. This morning in my own house, I'm trying to get ready, and, I had a dog that jumped in the pool and came into the home, and water was all over the place. So we all have, moments of stress, but just remembering to kind of take a deep breath. This too shall pass, and we're all going to be together at the end of this, and that's an amazing thing. So I will move on to some information about COVID, and some of this may be somewhat redundant, but I do want to do a quick review of what it is. Oh, let me see here. I'm sorry. I'm getting something that's saying the volume is not as good as it should be. Oh, can you hear me now?
Let's see.
Should I start over?
No, you're fine.
Okay. Okay. All right. So hopefully everyone can hear me now. I just kind of did a quick introduction about how it's important for all of us to realize that, we're really in all of this. We're in this pandemic together. Even though you're alone, we are all together. And I'm getting something that's saying using a different browser.
Yeah, no, Frank is helping some of our listeners to log in with a different...
Oh, got it. Okay.
Okay.
So I'm going to move on a little bit and just talk about kind of what COVID is. And some of this to some degree may be redundant for you, but I think it's important to kind of recognize what truly this virus, what it is. We really have never in the medical field seen a pathogen of this intense magnitude. As many of you may know, it's caused by a SARS-CoV virus, which is a severe respiratory distress coronavirus. There are many coronaviruses that exist that oftentimes will just cause mild common cold-like symptoms that have been around for eternity. The coronavirus, this COVID virus 19, it's different. It's new. We've never been exposed to it. We have no innate immunity, which is the big problem. And that's why I think you're seeing such a variable response person to person, depending on that person's immune system. So some people have a very robust immune response to this virus, and it goes a little haywire. Those can be the people, I think, that really see the severe symptoms of COVID, including the respiratory distress syndrome, while others seem to sail through it and have mild symptomatology. Some are completely asymptomatic and would not know otherwise that they were infected. So I think that's important to remind yourself of, is that this being a completely new strain of virus, none of our immune systems potentially are going to respond in the same manner, even amongst family members. So we're seeing, within our practice, we're doing a really great antibody test through Vibrid America, and members of the same family sometimes are having completely different results, yet it's extremely accurate in its test capability. So just hang in there. I think as more research comes out down the pipeline, we're going to have a lot more information available just regarding the how this virus is going to be behaving, and hopefully get us to the next stage where we've got more herd immunity and vaccination. Researchers, scientists are working feverishly to come up with a vaccine. The latest reports are showing hopefully by the end of the year we'll have a vaccination, but it may be next spring. So the good news with the vaccination standpoint is that since we are seeing such a robust immune response from many people, it should be a good vaccine. Like, our immune system should be able to recognize it and hopefully mount their own immune response and give us some affordable protection there. Going to kind of back to some baseline information. I mean, what is a virus? It's one of the most simple non-living organisms on the planet. So it's basically a core of genetic material surrounded by a protein shell. And I mean, it's survived for millions of years on this planet because it's pretty stealth. It knows how to survive. It's kind of really a parasite in a way, because it infects a host typically by inhalation. And it attaches to cells in our mucosa, like the lining of our nasal passageways is a really good place for viruses to attach. And then it begins a replication process. So the virus will enter the cells. It will spend several days. For COVID, for example, typically we're seeing about a 2 to 5 day replication window, where a lot of people have no idea that they were exposed. They may not have any symptoms at that point. They really just have what I like to call a subclinical infection. Hopefully at that point, immune systems respond to this and are able to fight some immune battle with this virus, and patients are getting away with very mild symptoms or maybe no symptoms at all. If there's some progression, it moves down, and this particular COVID virus has been found to bind to a very plentiful receptor in our cells to enter, called the ARB2 receptor. So it's angiotensin recepting blocker receptor. So there's an abundance of these receptors in the nasal passageways, and as the virus potentially moves down the windpipe and into the respiratory tract, that's another plentiful source for this particular receptor. And so that can explain why for that subset of patients with a robust immune response to this virus, that you're seeing a lot of respiratory symptoms and worst case scenario, respiratory distress and death. But for the majority of people, because it starts in the upper respiratory tract, you're going to see cold-like symptoms, sore throat, nasal congestion. There can be an absence of taste and smell. Sometimes we'll see headache as a presentation as well. And then, again, as it moves down into the lower respiratory tract, that's where you're seeing more of the intensive symptoms with the cough and shortness of breath. Really, anything can go with this virus, because we have these ARB receptors in the brain. There have been some case reports where patients are presenting with no other symptoms other than seizure to the ER, and they're found to be COVID positive. There have been case reports with severe gastrointestinal distress. Again, ARB receptors are plentiful in the GI tract. I read one case report I found very interesting that a woman presented with acute MI, heart attack symptoms in the ER. Her EKG was completely consistent with a heart attack. They took her to the cath lab, and there's no blockage, and she tested positive for COVID. So, and again, the cardiac tissue is a receptor site for these ARB2 receptors. So, it's pretty stealth, this virus, and what we tend to see, and I think it's getting more press now, is a response in the respiratory tract called a cytokine storm. So what is a cytokine storm? I kind of like to link it with what I consider, it's kind of a gale force of an inflammatory response. So when the virus moves into the respiratory tract, it provokes, in some individuals, an extreme immune response where the body's immune systems kind of go into hyperdrive, and the lung tissue attracts inflammatory cells that go there to fight off the virus, but sometimes these inflammatory cells that are coming from our own bodies start attacking even our own cells, and this just leads to a massive pool of inflammation, and outside of that, fluids start accumulating, oxygen saturations can drop, and the end point, severe respiratory distress and potentially failure can develop. It's frustrating from a physician standpoint, and I think just medicine in general, because we don't have a lot of good tools in our bag right now to fight off this infection and just viruses in general. Like if you have a bacterial infection, pneumonia, sinus infection, many times that can be treatable with an antibiotic. Antibiotics, as most of you know, do nothing for viral infections, including COVID. So the best we can do typically with viral infections is find treatments that really help to minimize this intensive inflammatory response, and hopefully, shorten the duration of your symptoms and the intensity. It's a little bit frightening in that way, in that we don't entirely know, what this virus is going to be, presenting in individuals. What we are seeing is that, there's some inconsistencies. It's infecting within a veracity healthy people with no known risk factors. So there's definitely some unknowns out there, but it seems to be more, concerning for patients that do have a higher risk factor for vascular underlying medical problems, such as diabetes, high blood pressure, high cholesterol, autoimmune disorders. So definitely that subset of the population has to be particularly careful, and are more susceptible to potentially this progressing if they do get the infection to the acute respiratory distress syndrome. So other research is coming in, and I will say it's pretty incredible to me. Every single week there's a report of at least 1,000 different papers being produced and published by researchers, 1,000 per week. So it's a massive response by the medical community to figure out what is going on. And a lot of that, a lot of those papers are not yet peer reviewed. So you kind of have to take that with a grain of salt, but I think hopefully this will provide a lot of great information, hopefully shortly. But going back to where we're at with a lot of the patients that we're seeing with the vascular disorders, we're seeing that this virus tends to have kind of some attack mode to cause what we like to term a vasculopathy, where maybe because these patients already have some underlying predisposition for vascular damage, and then this virus comes along, and because of this pro-inflammatory and cytokine response, it's further damaging to their vascular system, and it can interfere with blood clotting. So we're seeing some complications frequently. Up to 30% of patients now in the ICU, like post-mortem, are found to have significant blood clots, in their system. So that's one of the areas where, and I think a lot of ICU doctors are kind of throwing whatever they think is going to be helpful without really knowing, and IV heparin, like a blood thinner, is being used, IV vitamin C, steroids, methylprednisolone IV. anti-inflammatories, just really hoping to minimize the viral response to this cytokine storm. So again, just keeping in mind, our immune system, everyone's immune system is different. This is a brand new virus, and everybody's going to have a different response. And I think that that can answer a lot of questions that we're getting just regarding patients that have had antibody testing and how different their results can be even between family members living within the same household. I wanted to give you a quick update on statistically where we're at with the coronavirus infection, the COVID-19 here. In the United States, we're above the 1 million mark, which kind of worldwide represents more than half the cases in the world right here in the United States. And there's over 60,000 deaths at this point. I'd like to compare that because I think there's, I'm seeing a lot of press out there about influenza and kind of how this compares with the COVID virus. And, to date, this has been a really bad flu season on top of it. So flu infections are, globally 39 to 55 million, with about the same death rate, around 63 million or 63,000 deaths for the flu season thus far. You also have to take into consideration that the flu season has been several months longer than the COVID infection. Really, COVID was just recognized about 3 months ago. So I think when you kind of take that into consideration, with a similar death rate, that becomes more concerning. We also probably have underrepresented the number of cases of COVID because tests were not readily available, and they are becoming more readily available. So I do think the prevalence of the COVID-19 infection is something that we're going to be seeing go up and up and up, which ultimately will affect that mortality rate. Currently in the state of Arizona, we're at, as of this morning, around 7,600 cases, and there's about 320 deaths, and over half of those deaths are in Maricopa County. I think the good news is that a lot of the restrictions for testing have been lifted because testing is more available, where previously it was really just restricted for people who had classic symptoms, fever of 100.4 or higher, dry cough, shortness of breath, and exposure. That's not the case anymore. So if you do feel like, you're having some symptomatology, or you've been around someone who potentially who's had COVID, or you think you may have had exposure, there's no restrictions for testing. So you just have to find a site, like within our office, where you can get a reputable test done. So just keep that in mind as well. The peak of this infection, and I know the governor has extended our stay-at-home orders now until May 15th. We are seeing some different prediction models that are kind of looking, at least in the state of Arizona, for the peak to happen anywhere later in May, between May 22nd and even up to June 11th. So, and a lot of that depends on, how people continue to adhere to social distancing and containment strategies, such as limiting gatherings. So, all of that's important to keep in mind as well. There's, if you have relatives in other states, there's a lot of state-to-state variability with the stay-at-home orders. A lot of states are this week opening up and reducing their stay-at-home restrictions. So some of those states include Georgia, Texas, Michigan, Hawaii, Alaska, Alabama. So just kind of know that going into this weekend as well. I've seen some kind of concerning case reports from Southern California. They still have their stay-at-home order in place, and I guess beaches in Southern California are getting flooded with people going to the beach. So it's concerning because we don't know kind of what wave 2 is going to look like if there's a level of non-compliance that's still going on. The hope is that as more of us get exposed to this virus, and hopefully asymptomatically or with very mild symptoms, that we'll develop some antibody immunity to that. We're already seeing that, within the testing that we're doing here in the office. I had my concierge assistant yesterday kind of tally up everything that we've done in terms of testing. And for my own patients, my subset of patients that has tested, about 30%, and these are just voluntarily patients are coming in to be tested to see if they've been exposed. About 30% have either an IgM, which is an acute antibody response, meaning potential current infection, or a combination of the IgM and IgG, or IgG, meaning they've been exposed but have no current ongoing infection, or a small percent have an IgA response, which is kind of that transitional antibody. It's a gut antibody. So about 30% of people, just in a small cohort here, showing positive results. So I think, if you kind of extrapolate and look at that, and it's kind of going along the national consensus that probably 25 to 30% of people nationwide potentially are infected and don't know it. So I think we'll see more information coming out, in the near future on that. So and then the other part is with antibody development, how much protection does that really confer? We don't really know. I mean, we're hoping that it follows a lot of other types of infections where once we develop some protective immunity with IgG, that it will prevent or at least dissipate, if there's some reinfection down the line, and hopefully just prevent it altogether. But we don't really know. Again, it's just so early in this virus. We just have little pieces of this puzzle together right now, and we don't have the total picture yet. But as more information comes out, you'll be the first to know. So with all of this, I mean, what can we do? What can we focus on to really help to improve the chance that we're going to be able to manage this infection and any other viral or bacterial infection for that matter? I think the key really is just focusing on factors that help to improve our own individual baseline level of health. So, look at where you're at with your health. Are you a vasculopath? Meaning, do you have vascular risk factors, such as what I'd mentioned before? Are you diabetic? Do you have high blood pressure? Do you have high cholesterol? Do you have an autoimmune predisposition? Are you overweight? Do you have room to improve with your diet and exercise regimen? Most of us do. I printed this out because I have to show everybody my favorite word, which I think this is good. This is good if you can see this. Can everybody see this? Flossom. So this is my favorite word in the world, and you can all use it, but flossom. So, I mean, we are all flawed, but awesome, right? So genetically we're flawed, individually we're flawed, mentally we could be flawed. We're not perfect. So, but I think the take-home point is just making sure that we have the capacity to recognize that and change, and we do. So many times reversing your risk factors, utilizing what we tout all the time, eating a plant-based diet, exercising regularly, really addressing the root cause of where your medical problems are. And that's possible. It's not a life sentence when you have high cholesterol or you're diabetic. Many times, as within the functional medicine realm, it's important to look at the upstream rather than just the downstream management of disease. So you want to look for the root cause of where these problems start in the first place. And many things that do have a genetic predisposition, we see have antecedent triggers. So kind of looking at the timeline of your life, where did you first start feeling bad? Maybe it was after a vacation that you took to the Caribbean and you had a terrible gastrointestinal infection when you were there. Maybe it was under, emotional duress in your life. You went through a divorce or somebody in your family died. That can completely alter your microbiome and your gut. Maybe you were on too many antibiotics as a child. That completely changes up your microbiome. So there are so many options. So just kind of thinking back from a historical standpoint and looking at your timeline, like where did you start feeling bad, or maybe when did some of these disease processes begin for you? So that's really kind of a big passion of mine, and within our practice, we really look from a functional medicine standpoint how certain diseases are developing, where they've come from, and that gives us a lot of information and tools to hopefully reverse or minimize these issues for you. So I think kind of when I look at COVID-19, that's a big thing that sticks out in my mind, is just trying to minimize underlying risk factors that you have. So improving your baseline level of health. You know, you can't change your genetics, but you can change, you know, how you eat and how you think and your sleep patterns. You know, one of the things that's really important to you know, kind of look at overall is, you know, are you doing certain things maybe that could sabotage your health? You know, truly, it's what your mother always told you, and you are what you eat. So our gut is really not just this big tube where we ingest food and eliminate what we don't use. I think this is always fascinating to me. Like, our gut has 10 to the 14th bacteria in it. Think of that. That is more cells than we have in our entire body. We have bacteria in our gut. They have to be important, right? So all of this bacteria in our gut is constantly communicating with each other. There's good bacteria that we need to kind of maintain homeostasis in our gut and help absorb nutrients. But you can also have pathogenic or bad bacteria, and that throws off the balance of things, and that can create kind of this milieu of inflammation in the gut. It can contribute to inflammation in the gut, malabsorption, which we really think is a root cause for a lot of health problems to form in the first place. Autoimmune diseases, for one, just many different processes. I mean, bacteria in the gut, it's responsible for production of important neurochemicals like serotonin, which is the feel-good, you know, neurotransmitter in our brains. Our enteric nervous system that connects our gut with our brain, you know, communicates directly. So if there's some gut imbalance, that can affect our moods. It can affect how we're perceiving things. It can affect our sleep cycles. You know, it can affect, you know, it can contribute to brain fog. You know, if we have a predisposition for, you know, neurodegenerative disorders, potentially it could affect all of that. So really just taking some accountability for your diet and exercise is a big part of how we can kind of get each other back on track here, and hopefully be able to strengthen our immune systems in these times of pandemics. So, you know, when we look at the GI tract in general, and some of the very common things that really most of us should always avoid, that are typically very pro-inflammatory, wheat, you know, dairy is a big one, and sugar. You know, so those tend to be the big three. And, you know, so there's many other ones beyond that, and depending on your individuality, that's where potentially doing some food sensitivity testing can come into play, and you can determine individually, you know, if there's some level of sensitivity there that, you know, where you're ingesting things that could be pro-inflammatory for your GI tract, that could be, you know, causing inflammation, leaky gut. Food particles kind of seep into your system, which can alter your immune system, and that's really what we're talking about here. And that can lead to an increased predisposition for all of these problems, not only a decreased ability for you to fight off infection, but an increased ability that, you know, it could unmask heart disease or diabetes or high blood pressure or neurocognitive decline. So very important to kind of look at how you're treating your body and what you're consuming. I'll kind of go back on track, and one of the big things that I wanted to address with all of you, and I think this is very timely, is just some things that you can consider looking at to really boost your immune system. So these are supplements that are really key in helping to support your immune system and improving its chances to ward off infection. These things can help improve your cellular detoxification pathways, your energy, just keep you healthy in general. And you know, there have been some supplements that have been studied. Kind of early studies are showing even some promise that they can have some antiviral properties, which is amazing. I mean, nature's smart, that nature can create plants that we can create supplements for that could actually potentially fight off viruses and infection and be helpful in this fight against COVID-19. So the first one that I'm going to talk with you about, and you may have heard of, it's called Quercetin. If you have a pen and paper handy, you may want to write some of these down. Some of these may already be in your medicine cabinet, which is great. But quercetin, just to kind of let you know what this is, it's a very potent antioxidant and anti-inflammatory. It's been shown to have antiviral effects against both RNA viruses, which is COVID and influenza, and even DNA viruses such as herpes virus. It can inhibit viral replication, and it helps to downregulate our inflammatory response. So it works to kind of modulate signaling pathways that are also associated with post-viral healing and, protecting the body against damaging free radicals that are released really from every metabolic process in the body. So quercetin is the antioxidant-rich plant pigment. It's called a flavonoid. It's often found in broccoli, green tea, berries, onions, citrus fruits, but it's way more intensely concentrated in the supplemental form. So it's typically recommended to take quercetin in the dose of 500 to 1,000 milligrams twice a day. And it's very well tolerated. Most people do very well with it. And it can also help during allergy season, I will add. The second supplement is curcumin, and that also has been shown to modulate the viral inflammatory response. And it may be able to target COVID-19 through some initial studies by affecting protease, which is an enzyme that helps to reduce COVID viral replication. So that's pretty incredible. It's anti-inflammatory. Curcumin is antioxidant rich. It can even be anti-tumor. And it's well tolerated. So that is typically recommended to take at a dose between 500 to 1,000 milligrams twice a day as well. In foods, it's not going to be as concentrated as in the supplement, but you can find it in turmeric root. It's similar to in appearance to ginger root. It's the turmeric gives the curcumin its kind of distinctive color of that intense yellow-orange. So again, curcumin can be a fantastic supplement to add to your regimen. The third supplement is EGCG. I'm going to try not to mess this long word up, but it's epigallocatechin gallate. Okay, so we just call it EGCG, but it's found in green tea. So that's really amazing. So really just drinking ideally 4 cups of green tea every single day, or if you're not able to do green tea or you just don't like it, you can take supplemental EGCG up to 225 milligrams daily. And you're also going to see some antiviral action against COVID. It also is helpful for decreasing the inflammatory response. This one you want to be careful with because more is not necessarily better. There are some rare cases where this particular supplement, EGCG, can cause some liver toxicity. So just keep it within the recommended amount for that. One of my favorite supplements that I'm going to add is N-acetylcysteine, so NAC. And again, many of you may have this already in your medicine cabinet. So this is an amino acid, and typically you want to do a dose of 600 to 900 milligrams up to twice a day. What this does is it promotes glutathione production intracellularly within our mitochondria, which are kind of the powerhouses inside of our cells that help with cellular detoxification, energy processing, cellular repair. Some studies that have been done with N-acetylcysteine and influenza infections show even a number of sick days reduced and the overall severity of infection with influenza reduced by doing some supplemental N-acetylcysteine. So you can't directly get N-acetylcysteine through food. You can only get it through a supplement, but it's a different form, which is cysteine, can be found in foods such as chicken, turkey, garlic, eggs, and yogurt. So I will mention that. The next supplement that's a good one to consider is Resveratrol. So this is a naturally occurring polyphenol. It's a potent cellular antioxidant, and it's a free radical fighter. It's an inflammation buster, and it has antiviral benefits as well. So you want to take this one at a dose of 100 to 150 milligrams daily, and ideally in a supplement form. There are foods that contain resveratrol, but they're not nearly as concentrated, so you're not going to see the end result and the benefits really from the food consumption of foods that contain the resveratrol. But foods that do contain it include peanuts, pistachios, grapes. Be careful, but red and white wine, blueberries, cranberries, cocoa, and dark chocolate. But again, they're pretty minute amounts of the resveratrol, and the supplement, you're gonna have a lot more bang for your buck on that one. Another supplement that's pretty common, but fantastic for viral infections, is vitamin D. So vitamin D, it's a fat-soluble vitamin, and when it's activated, it serves as a steroid hormone that the immune system uses to modulate and improve infection, while it's helping the white blood cells fight off infection. And supplemental vitamin D, kind of long through many past studies, has been shown to improve upper respiratory cold-like symptoms. It's important to have your vitamin D level monitored by a physician, because it is one vitamin that you can overdose on potentially and have some negative side effects with. So typically, periodically checking a serum vitamin D level if you're taking vitamin D supplement is going to be really important. So an optimal level typically is between 50 to 80 milligrams per milliliter, when you have your blood work drawn. And the recommended dose typically, I go typically anywhere between 2 and 5,000 international units a day. But again, you've got to have some consistent monitoring by your physician with, some blood work. Usually I will check vitamin D levels every 3 months or so, kind of depending on if we're adjusting dosages up. So just be aware of that. Another supplement that's gotten some press for being helpful for COVID and viral infections in general is melatonin. So most of you have heard of this. Usually it's utilized to take at nighttime to help with our sleep stages, help promote sleep, kind of reset our circadian rhythm. But 5 to 10 milligrams of melatonin every day has an inhibitory effect on inflammatory mediators with COVID infections. So there's been 2 recently published papers that are proposing the use of melatonin as a therapeutic agent specifically to help treat COVID infections. So I find that pretty incredible. The next supplement on the list is vitamin A. So another fat-soluble vitamin. So you want to be careful, because although rare, there is potentially some possibility for toxicity with vitamin A. So that would be another one that you would want to have monitored if you're going to be starting a vitamin A supplement. Kind of historically, it's important for vision and growth development, but it's also important for mucosal protection. So it's anti-inflammatory. It's really a key player in helping to regulate our cellular immune response and our cytokine production. So for vitamin A, during the COVID pandemic, the recommended dose on that is anywhere between 10,000 to 25,000 international units daily. But once again, more importantly, under the care of your physician. It needs to be monitored. Next on my list is elderberry, and there are many different elderberry supplements out there. The one that you want to look at really should come from a reputable source, and it should come from the berries or the flowers, which is the important part that's going to have the antiviral benefit. 500 milligrams daily is typically what's been recommended, and it can be particularly helpful at the early onset of these viral infections. The next supplement is a little bit of a less typical supplement. It's an amino acid called PEA. And again, I'll try not to butcher this, but it's palmitoyl ethanolamide. I think I did it. So PEA, much easier to say that, but it's an amino acid that inhibits tumor necrosis factor alpha. And so it helps with mast cell stabilization. This could help, I think this is pretty amazing. This could actually help with reducing that cytokine storm. The dosage is recommended at 300 milligrams twice a day. And then, if acute symptoms are developing with COVID, suggestion is to go up to as much as 600 milligrams twice a day for 2 weeks during the acute infectious phase. So that one's on there. Vitamin C, we all love vitamin C. So vitamin C, and again, some recent reports are showing even ICU doctors utilizing IV vitamin C to help treat their severely sick patients, and are seeing some positive benefits from this. So, but orally, 1,000 to 3,000 milligrams a day is typically what you want to look at dosage-wise for vitamin C, and this is really going to help with your immune defense. It supports just cellular function in general, microbial killing. So, definitely remember vitamin C as an option there. And then the last supplement I have on my list is zinc. So it's a very popular supplement during times of viral infections. Typically 30 to 60 milligrams a day, and there are different forms that are generally equally as efficacious, but zinc can come in a picolinate form, citrate form, glycinate, acetate. It's best to ideally break the zinc dosage up into twice a day dosing. So if you're going to be doing 30 milligrams a day, kind of as more of a preventative, try to do 15 and 15, going up to 60 milligrams. I've even seen some case studies showing it's safe to go up to 75 milligrams a day, but trying to break that up just for better efficacy into twice a day dosing. And again, zinc has been shown to suppress viral attachment to those mucosal cells, and inhibits viral replication. So it's certainly possible, especially during early infectious stages, that it can be useful to entirely prevent the infection, and kind of midpoint to maybe help reduce the severity and duration of symptoms. So that is what I have, and I hope this was useful for you. I guess we can go to some questions, and then we have a really nice presentation today with our amazing functional dietitian, Dana. So we'll get to that afterwards. All right, so let's see if I can load up some questions here. Okay, great.
Regarding the supplements mentioned, your thoughts on two things. One, with or without food, and two, okay to take all the supplements at once or space them out.
Mm-hmm. I think just so it's not a complete belly bomb. I mean, with a list that lengthy, so I reviewed about 12 supplements. I mean, some people have an iron gut and can take all of them at one time, but I do think for absorption purposes, it's better to split them up. So if you can split them up and do a few in the morning, maybe a few in the afternoon, a few in the evening for one, I think it's going to be better tolerated. It's going to be better absorbed, and for the most part, taking it with a little bit of food on your tummy is, I think, probably the better way to go. I see more often than not on an empty stomach, you start feeling nauseated, and the absorption can be diminished, and it's kind of inhibitory if you dread taking your supplements because you're getting nauseated too. Like, they're not going to do any good just sitting in your medicine cabinet. So I do think just splitting them up, into 2 to 3 times a day dosing would be ideal.
What are your suggestions to help us as we re-engage in the community, as businesses open up again and people are scared to go back out? How do you suggest addressing that?
Mm-hmm. Yeah, I mean, it's inevitable, and as states are opening up, and, probably to some degree in the next 4 weeks, things are going to be opening up here in Arizona. I think that there's probably just going to be a little bit of a cautious optimism. I think this is going to change the way people act and react, and I think hopefully just being more cognizant of, at least until we can kind of see where we're going to be going with this peak. We don't know. There's been some studies that are kind of looking at reinfection in the fall, and especially the virility of that when we're knee deep into the start of influenza season. So I think you just you have to keep that in mind. And I think that, once the stay-at-home order is lifted, I don't necessarily think it's a great idea for everyone just to go out and, take large groups of people to movies and have parties and, go to crowded restaurants. And I also think that you have to look at your health history, and so it really has to be an individual decision. It's important for people to be with people, but maybe just kind of slow acclimation back into the social scene is probably the smart way to go.
Do you know how COVID affects a person with Sjogren's syndrome?
With Sjogren's? Well, there haven't, to what I've been seeing in terms of literature, nothing specific in terms of studies. And again, this is just such a new infection that I'm sure down the pipeline there will be more studies coming out with individual autoimmune diseases. But in general, I think we can kind of extrapolate and say, with any autoimmune condition, you want to be more cautious because you're already kind of coming into this pandemic with some immunocompromise. So really, again, just refocusing on what you can do to kind of boost your cellular immunity and keep yourself as healthy as possible.
Can you comment on the use of masks?
Mm-hmm. Well, yes. From what I see, like cloth masks, really, they're probably better than nothing. They're going to inhibit some ability for us to expel virus to others, but studies don't show that they really have the filtering capability to not get into our mask and cause infection. I think, so cloth masks in general, probably better than nothing. They can be a good source to help us, remind us not to touch our faces. When you're wearing a mask, you're less likely to touch your face, which can be a big part of just the infectious process itself. Anytime you've touched something that, and maybe it's not even, it's COVID, it's another virus, and we introduce that to our face, our nasal passageways, then we're definitely at an increased risk for developing infection. Medical grade masks are going to be better. Again, they're typically not super tightly, adherent to the face, but they are a good idea. And if you're going to be going out into public, if you have to make a run to Target or the grocery store, wherever you're going to be, where you're going to be out in closer proximity to people, I think wearing a mask is important. And then the N95s again are really just for people, medical personnel, and patients that are going to be in that high risk setting. So hopefully that answers the question.
Yeah, good. How in the world can my oldest son, his 2 daughters, and my husband test positive and I test completely negative? Does the virus skip some of us?
So yeah, this might be my patient. So we are seeing it again. This is kind of the newness of antibody testing, and again, within our practice, specifically the lab that we've chosen to run through Vibrant America is about 91 to 94% sensitive at picking up true positives, meaning, there's a less than 5-6% chance that if you test positive that it's a false positive. And then it's about 99% specific, meaning if your test is negative, there's a less than 1% chance it's truly, it's a false negative. So they're very accurate. So, having said that, and as I mentioned earlier in my talk, we are seeing kind of pockets where families are being tested. Some are positive for acute, infection or at least exposure with IgM positive results. Others are totally negative. So I think it goes back to, we don't really know, because the individuality of this is, going to come into play, and everyone's immune systems are different. So what one person's immune system can like robustly respond to another's might take more of a lackadaisical approach and, maybe not have enough of a viral load even to really show symptomatology. So there could be a couple of factors that come into play with that.
What is considered a medical grade mask?
Well, a medical grade mask typically is, so the N95 is really the medical grade mask that you're going to see ICU doctors, anyone like within the health profession utilizing. So those have really the most stringent filtration standards, and they're fit very tightly. So, in terms of being a medical grade mask, that's what we're talking about. The kind of the blue masks, sometimes they're white. You see a lot of people walking around in grocery stores or just out in public with more of a, kind of just, it's more of like a surgical mask. So those are kind of an in-between grade of a mask, and they're generally very sufficient for, being out in the public.
What about the latest update on the drug Remdesivir and the 2-year projection of coronavirus?
So Remdesivir, just to kind of recap, because that is getting there's a lot of press and stories coming out on that. It's basically, it's an antiviral drug. It targets viral replication. It's actually been used in different studies, and it shows some efficacy to help diminish other coronaviruses. And so that's why when COVID-19 came up, that it's one of the drugs that kind of was on the radar. It does look like, and this is totally preliminary, there's still, it's sort of, to be determined, but initially here, it's looking like it is kind of in the sickest of patients, helping to reduce death rates. So, for example, it's been reported, typically like amongst the sickest patients, death rates can drop from 11 to even 8% with the Remdesivir. So that's significant. And then the other component is it's helping to have a faster recovery. It's suggested that we're looking at about a 30 to 31% improvement in recovery rate. It's, for those sick patients within the ICU setting, so they're getting out of the hospital faster, on average about 11 days with the Remdesivir.
Okay. 2 more questions.
Okay.
How should you react when someone tells you they tested positive for COVID infection or exposure?
Mm-hmm. That's a great question, because as we test, as more of this testing is becoming available and we're seeing more infections, it's scaring people. So what I would do is think about, how am I feeling? If there was enough potential exposure there, you could always consider getting tested yourself, and depending on where that window was, where you were around that person. Again, keeping in mind that it could be 2 to 5 days where you were exposed to the virus, but not yet mounting an immune response. Some studies show even up to 27 days, like you could have been exposed 27 days ago, and it takes 27 days to mount an effective immune response, where you're going to see an IgM level rise or an IgG level rise, or that IgM, increase. So there's no perfect answer for that, but I would say just be cognizant of it. Think about starting to look into ways to get yourself tested, and if you're around anyone that is higher risk, if you have somebody that's elderly in your home, or anyone that you're around on a regular basis that has higher risk medical conditions like we had spoken about, that's diabetic, high blood pressure, high cholesterol, cancer, and you've potentially had some COVID exposure, then I think that's even more fuel to consider maybe getting yourself tested. And the antibody test can be something worthwhile to consider on that.
Okay, last question.
Mm-hmm.
What should I do if I know someone tested positive and is not being honest about their status to others?
That's a tricky one. I would try to encourage that person to come forward. I mean, this is a reality, this is a reality, and probably most of us at some point are going to have some level of exposure. I mean, that's it's kind of looking like it's going in that direction. So it's nothing to be ashamed of. It's not your fault or that person's fault that they've been exposed to it or they actively have some infection. But I think it puts a lot of onus on that person if, either symptomatically or even asymptomatically, they're testing positive for the acute antibody, where they could be actively shedding virus and passing it on to others that are higher risk, that could get really sick. So I would probably nicely encourage that person to come forward, and if all else fails, just maybe put it out there that that this person potentially has tested positive, and because I think people do need to be aware. Well, thank you so much. I hope you enjoyed today. I had a lot of fun and it was fantastic. Don't go away, because we have our amazing functional-based registered dietitian, Dana Bosselman, who is going to cook up an amazing, I smell it already, it's a broccoli, pineapple, colors of the rainbow salad. So I'm going to kind of shift the camera towards her so you can see what she's doing, and I can't wait to taste this. All right, everyone, have an amazing day. Take care.